Hello, this is my dental filling materials presentation. So what are dental fillings? Dental fillings are restorative materials that give back the function and shape to a missing part of a tooth. In this slide, I've attached a picture of an amalgam restoration and a composite restoration. So here's a statistic. About 175 million filling operations are performed in the United States every year. Types of materials include amalgam, composite, gold, ceramic, and glass ionomer. So filling materials are selected based on the class of the cavity that needs to be filled. So for example, a class 1 cavity is located in the pits and fissures on the occlusal surfaces of molars and premolars, or on the lingual and buccal pits of the molars of maxillary incisors. So an amalgam filling or composite resin would be selected depending on the location and the strength needed to fill the decay. Cavities located on anterior teeth are usually restored with tooth-colored materials for aesthetic reasons. So here are two charts showing the dental caries classifications and cavity preparation classifications. I want to talk about the different cavity classifications and the types of materials that are typically used for each class. I mentioned class 1 in the previous slide, so I'll start with class 2. Silver amalgam or composite is typically used. If the decay is extensive, a gold or porcelain inlay, onlay, or crown might be used. For class 3, composite for the aesthetic appearance. For class 4, composite for the aesthetic appearance. If decay is extensive, maybe a porcelain crown will be used. For class 5, silver amalgam or composite resin for anterior teeth. And class 6 would use a composite resin. So first, amalgam is the most common filling material. It's shiny and silver in appearance. A powdered alloy composed of silver, tin, copper, and liquid elemental mercury, usually found in a capsule. That's what it's made out of. To explain further, the silver, tin, and copper particles combine with the chemical properties in the mercury to form the amalgam. So when the capsule is placed in an amalgamator, it is triturated, which turns the material into an evenly mixed, putty-like substance. It is then placed and shaped into the cavity prep. So there's a picture of the capsule and what the materials on the inside look like, and then another picture of the amalgamator. So amalgam hardens by itself. It sets in about 24 hours. It's the least expensive filling material. On average, it's about $50 to $150, and it's long-lasting. It can last about 10 to 15 years. So, mercury poisoning. Amalgam fillings can be considered a potential risk due to mercury. The filling can release mercury in vapor form at a low level, which can then be absorbed and inhaled into the lungs. High levels of mercury exposure can cause harmful effects on the brain and kidneys. However, the FDA has deemed amalgam fillings safe for adults and children who are above the age of 6 years old. So composite resins. It's made of plastic and acrylic resin that is fortified by powdered glass filler. This is a tooth-colored material. It's available in many different shades made to match the patient's exact tooth color. It needs to be cured by a UV light. It usually sets in 40 seconds. It's very durable, usually lasts up to 5 years, and usually more costly than amalgam, but on average it's $90 to $250. So I have pictures of a composite restoration being filled and what it looks like when it's done, and the tubes that the composite material comes in. It's preferred by patients because they don't stand out as much because they're tooth colored. So next is gold inlays and onlays. Inlays can be used when only a small amount of the tooth is affected by decay. Inlays are made to fit inside of the tooth, and onlays also fit inside the tooth, but they branch out to the occlusal surfaces as well. So cast gold fillings are made of gold mixed with other materials like copper and silver. They're made in a dental laboratory using a cast of the patient's mouth. The filling is cemented onto the tooth afterwards. It's expensive, on average $900. And it's extremely durable. It can last up to 15 years. So this picture on the bottom shows the difference between an inlay, an onlay, and a crown, and on the top is an example of gold inlays and onlays. Ceramic inlays. They're mainly made of porcelain and can be made to match any tooth color. They're very strong. They can last up to 20 years in the mouth. When the decay is taken out of the tooth, it is then sealed in with the ceramic material. It's the least toxic of any material because of the lack of metal and mercury. It's more resistant to cracks and staining. It's expensive due to their durability and cosmetic benefits. Average is $900. And a bigger portion of the tooth is taken away to make room for the larger ceramic filling. I mean, usually you want to leave most of the healthy tooth structure that you can, but this case it's an exception. All these materials have their advantages and disadvantages, so that's just one of the drawbacks. So glass ionomer. It's made of a special glass and acrylic. It's most often used for fillings that are below the gum line and are not used on the occlusal surface. It's commonly used in pediatrics. It contains fluoride, which is great for preventing the further development of decay. They're adhered directly to the tooth. They're weak and may fracture easily, could last 5 years at the most in the mouth, and they're not as expensive. They're closer to the cost of a composite filling. So here is showing the decay and the restoration afterwards. So another statistic, approximately 91% of U.S. adults aged 20 to 64 have had dental caries on their permanent teeth. So why are dental fillings important? Without a restorative material, the decay would spread into the entire tooth. When the entire tooth is affected, the tooth may need a root canal treatment or to be extracted. It is of importance that patients know their filling options and trust that the dentist will find the right material to repair the tooth. It is crucial to save the anatomy and function of a tooth before decay spreads any further. So here are my works cited. And here's a video. I think that this video provides a good explanation of restorations. This video talks a lot more about crowns than I did because a crown isn't exactly a filling material. However, I think it's important to understand when the tooth needs more than a filling as well.
When you have a tooth that needs a restoration, we can choose from a range of different types, including fillings, inlays, onlays, and crowns. All restorations seal out bacteria and restore the shape of the tooth, so the type we recommend usually depends on how strong the tooth is and how much tooth structure has been lost. Both silver and tooth-colored fillings can usually be placed in a single appointment. They work well to restore the tooth when only a small amount of tooth structure has been lost. But when a tooth has suffered more extensive damage, there may not be enough structure remaining to hold a filling in place without risk of breaking the tooth. On the other end of the scale is a crown. Crowns completely cover the top and sides of a tooth, protecting it and restoring its shape and function. We may choose a crown when a lot of tooth structure has been lost, and in cases where the tooth is weak, has had root canal therapy, is under a lot of stress from heavy biting forces, or is cracked or broken off above the gum line. When a tooth needs more than a filling, but less than a crown, we may recommend an inlay or onlay. Like a crown, inlays and onlays are custom crafted to precisely fit your tooth, so they may take 2 or more appointments to complete. An inlay fills in the area lost to tooth decay, usually in the grooves between the cusps of the biting surface of the tooth. We might choose an inlay over a filling when we need to use a stronger material or when a more durable restoration is needed. An onlay is more like a crown because it covers both the grooves and 1 or more of the cusps. We might choose an onlay over a crown when the biting surface needs to be restored, but much of the tooth structure is still strong and healthy. If you are thinking about delaying treatment, you should know that tooth decay will never go away on its own. It grows slowly while it's still in the hard outer enamel, but if decay is allowed to reach the softer inner dentin, it grows much more quickly and can infect the pulp chamber. If it gets into the pulp chamber, you'll need root canal therapy to save the tooth. That's why we recommend treating the tooth as soon as possible, with the best restoration for your situation.
And that concludes my presentation. Thank you.